One of the questions that people ask me a lot, that I see a lot of people to discuss, is plastic surgery or technology. Okay? There comes a point where, remember, we all have genetic challenges. Sometimes, no matter what, people just want more. And I spent a lot of time before I went back and retrained as an anesthesiologist working with plastic surgeons. And I have an opinion about this that's based on experience. And so I want to discuss this with people because it's such a common question. The bottom line is plastic surgery certainly has its place, okay? The earlier you start to prevent and reverse, the better. So there's a reason that you deal with yourself internally, you deal with yourself externally. You're using the vitamin C pluses, the vitamin A pluses, the peels, the serums, all the Start and Advanced Skin products proactively. You start in your teens and 20s, okay? Because you're slowing down, you're turning back the clock. And that makes a difference no matter what your genetic challenges are. If you wait too long, sometimes we look at you and we go, well, we can do X, but we may not be able to do Y unless we do a lot of work. So we discuss with you, what's the best tool for your job, because people want immediate gratification often, and how you get it, everything has a price, okay? So plastic surgery. Look, with plastic surgery, you're not doing anything for the quality of the skin to rejuvenate it. And one of the things that I used to loathe seeing more than anything is people who would have plastic surgery. Their skin is thin, it has brown spots, it has enlarged pores, it has little growths, it has abnormal veins, it had redness, and they increasingly, as you just take this skin and pull it tighter, and you're not doing anything for the quality of the skin, you begin to look like a skeleton with the skin pulled, and everybody knows that you had plastic surgery. You look like plastic surgery. In my opinion, that is not what my aesthetic and what I think is what you want. I don't think that's what people are looking for. I think people often do it because they haven't investigated their options and they don't know what their options are. I think you want to look as young as possible, understanding that life leads to death. We can't ever make you look 21 again, but we can slow down the clock, we can volumize the skin, we can get rid of your enlarged pores, we can get rid of your brown spots, we can make you healthier, we can give you energy, we can give you hair, we can tighten your eyelids, we can tighten your jowling, we can tighten your neck, and you don't have scars that you've got to cover up with your hair. And with men, remember, men scar more aggressively. They always look, in my aesthetic, medicine's an art as well as a science, like they've had plastic surgery, especially under their eyelids, especially here where they can't cover it up. They've got sideburns, and everything's coming up. Their hairline's going back. The women, their hairline is going back. And I mean, nobody does brow lifts, whatever, anymore. Lasers, technology is much better for that for a number of years than any sort of brow lift, okay? Now, with eyelids, the reason that I prefer, my aesthetic, that I prefer to do Morpheus or Forma, Accutite, is because you can tighten them progressively. People look at you. Yes, you're going to have a week or 2 weeks of downtime. I can give you a bruise. You're going to be swollen some, but nobody can tell. They're looking at you. They're trying to figure out, what did you have done? And they just saw you not that long ago, and you look younger. But remember, it doesn't happen overnight. There's no presto with the skin, especially as we go down the path of life. But they can't tell what you had done, but you look younger. You're more volumized. You see the girl, you see the boy. It's volumized, it's lifted and tightened. Now, I dress your bones so that your bones are not thinning. There's the exercising certainly helps the muscles. There's certain things that increase your growth hormone that help the muscles as well. There's all those pieces of the puzzle that you can do, and you never look like you're, tightened, like this is all pulled, the side of your mouth is pulled up, etc. You don't have a big scar if you have an abdominoplasty. You don't have a big scar if you've had your arms done or your thighs done. With liposuction, I deal with patients who had liposuction, and what happens is, as we go down the path of life and we lose more fat, they hate the crinkling more than they hated the fat. There are ways to do it technologically. Is it progressive? Is it not as fast? Yes, but after plastic surgery, people are often swollen for a good 6 months, and then people begin to get unhappy. The other thing is, if you haven't done anything for the integrity of the skin, then what happens is, after a year to 2 years, people get unhappy again. So I encourage you, I'm trying to educate you to investigate your options. Choose what is best for you. Choose what resonates with you. But have somebody talk to you about the advantages, the pros and cons of this versus that, of technology versus plastic surgery, and think about the scarring and what is it doing to truly rejuvenate you.